And everyone knows every Monday night when I say we are live, it means I'm really happy. So far, the internet gods have been on my side and nothing has happened. And I always work on my stress when something does. So in the beginning, I'm always a little anxious because no one's immune. So this is TMS Roundtable. My name is Dr. Tova Goldfein. I usually am here with Rose Hoy, my co-host and a good friend from Melbourne, Australia, who's not with us the last few weeks, but we send her blessings and love and healing. I'm very happy this week to invite a friend and a colleague that I just met, Dara Secker. Did I pronounce it right?
Secker. Totally fine.
I put this up because I wrote this. And I've been advertising you and your bio, all week. And I kept thinking, well, you're this masters of physical therapy. You have all this knowledge about, breathing and healing. And we connected on John Sarno and all this mind body. And then your bio is all about relationship with God. And I thought, the people that I have met over the last 3 years in this healing world of mind body, some of the most amazing stories have come from people's relationship with God. And Rose and I did a show a little bit, something like it years ago, but I would love to address that a bit by first asking you to do a few things, and I'll try not to interrupt like an Israeli, because I want to hear from you. But I want to hear, first of all, a lot about healing and God, because for me, it's very important. And I think in every show, we touch that space where God is, which is pretty much everywhere. But Dara, I want to ask you, first of all, how you got to be a physical therapist. Did you have any chronic pain? What's been driving you to be more mind, body, spirit than other physical therapists, than most people in your profession? So would you share from soup to nuts, and I won't interrupt.
I love to talk, so if you need to interrupt because I'm going on too long, feel free.
Okay.
So I wanted to study physical therapy from the time I started college. My mom actually said to me that she thought it would be a great career for me. And of course, initially I wasn't really listening because, who listens to, mothers are always right. We ultimately learn that, but who really listens to their mother? But I started exercising when I was around 17, 18 years old, and I really loved exercise. And then at a certain point, I was like taking aerobics, like it was like the late 80s. My family moved to Israel when I was 15. So I was sort of brought here. It wasn't really a choice. It wasn't my choice. I didn't want to be here. And so when I was 18, I actually left and I moved to New York on my own. And it took me about a week to realize I really did want to live in Israel. I just needed to do it in my own time frame. I had become a lot more Israeli than I knew. So anyways, around the time I was 18, I actually lost a lot of weight and I started exercising. And my father has always exercised, and my mother intermittently always exercised as well. Even before it was like in vogue, even before Jane Fonda, my father was a runner. My mom would run sometimes. So I did have that background in seeing my parents. But when I lost weight initially, when I was about 18 years old and I started exercising, I've never looked back since then. So I would take like aerobic classes. That's what was in style in the late 80s, early 90s, step. And there was one point where I went to a class at this gym I was at, and it was so awful. Like, it was so awful that the person at the desk said to me, like, I complained, and I'm not really a complainer. And she's like, do you think you could do better? So I was like, yeah, I think I could do better. So they said, okay, next Sunday you take over. So I kind of started a little bit teaching aerobics. It was like, not Jack LaLanne. It was another one, Living Well Lady or Spa Lady. I don't know, something like that. Literally in New York City on like 50th Street. And I taught like a few classes for them. But it didn't become like a big thing then. Then I moved back to Israel in 1995 when I was ready. I was 25 years old. And gyms and aerobics, and I had been doing kickboxing in New York and boxing in New York, and all of that was very, very new in Israel. Israel was opening its like first, like the YMCA had maybe opened a couple of years before. And
at this point, you had no injury. You were just like getting in touch with your body.
Thank God, no. And so I started teaching aerobics, like without actually ever learning it. I started teaching aerobics, and I sort of got, how do you break things down? How do you give it over in a way that can make people understand it. Because I'd watch all these teachers who didn't teach, like they would just, just follow me, just do what I do. And the class was so complicated, but I actually figured out on my own how to like break down very complicated things step by step so that people were moving the entire time. Nobody was standing and watching. And I kind of figured out. So ultimately I ended up teaching in a course here in Israel. And the woman said, please don't tell anyone that you didn't take a course. But I, for a couple of years, taught. And
so you lied about your CV.
Yeah, like I just kind of didn't talk about that. But when I first came back to Israel when I was 25, like I had intentions for a few years to study physical therapy, but I wasn't the most motivated student. So there were a lot of things I needed to do. I needed to take physics and statistics, and there was just a lot to do. So when I decided to come back in 1995, I literally told everyone I'm going back to Israel and I'm going to go to Tel Aviv University and I'm going to study physical therapy. Like that's what I thought I was going to do. So I came back and I first started teaching aerobics and doing all of that. And it really bothered me when somebody would say my knee hurts and I didn't know what to tell them. Like I wanted to understand why their knee hurt and what could I tell them. And then I looked into going to Tel Aviv University and saw that I would need the psychometry, which I was like, I'm not going to study for that test. That's dumb. And they wanted me to take 4 years of college over again to get a BA. I'm like, well, none of that seems right. So I kind of went with it. And a couple of years later, Wingate opened their first sports therapy class. So I was like, well, sports therapy, that's orthopedic. Like that kind of sounds like what I want to do. Let me take it. So it was great. I guess intellectually, it gave me a lot of knowledge, but there was no internship at all. So basically, there was no practical work. Like you didn't really know how to use it. But I subsequently got married, and my husband at the time decided, with me that we should go to America for a few years. And I said, great, I want to study physical therapy. So that's what I did. So I went back to PT school at 34, pregnant with my third child. And I'm happy that I studied later because I don't know that I would have gotten to what I'm doing now if I'd gone much younger. Like who knows,
So at what point did you start to understand that there's something more than just a physical pain and there's something about the breathing? When did you just start to integrate that?
When I was still in PT school, because I kind of heard in the background people talking about diaphragmatic breathing, and I heard in the background people talking about stabilizing and neutral, where there were all these, so in my second to last clinical affiliation, where I basically was done with all my classes at PT school and I was just doing internship, 2 10-week internships. And I remember I literally was arguing with the person who was sort of my boss because I was explaining to him, no, I don't think we should be pushing our lower back into the floor. I don't think we should be getting rid of that arch. And, breathing does all of these good things, but I just kind of knew that there should be diaphragmatic breathing, but I didn't really know what it was. I hadn't taken any courses at the time. So
let's just stop for a minute because I think there's some people in the studio. Let's just stop and people listening on Facebook. But I think it's very important because I didn't even get this in chiropractic school. I mean, it took me 30 something years to start to realize the importance, and Rose would educate me, and she's a psychotherapist. The importance of diaphragmatic breathing, which means deep breathing, right? Let's talk about the importance to our healing chronic pain.
Okay, so basically this is the way I explain it. And because I said that I understood how to break things down, even as an aerobics teacher, right? Everything with me is about how can I make even the littlest kid understand what I want them to do? So I have a tendency to break things down because if I can't explain it to a kindergartner, I don't really understand it myself. Good point. I will break things down. So even with every patient who comes into me, I am explaining to them how the stabilizing system works, how the breathing system works, and why it's important. Even if they broke their ankle, I'm going to make them breathe. I retrain everybody's stabilizing system. But the bottom line is,
I'm talking about the breathing. Why did you bring in the word stabilizing?
Because the breathing system is actually what controls the stabilizing system of the body. The stabilizing, the deep intrinsic system of the body is made up of your diaphragm on the top, your pelvic floor on the bottom, the very deepest layer of the stomach, the transverse abdominis, and the deepest layer of the back, the multifidus. And those 4 things have a very special relationship with each other.
And they're called the stabilizing.
They're called the deep stabilizing system or the intrinsic stabilizing system. And what actually controls them is breathing. Wow. But in order for me to breathe really deeply the way I'm supposed to, my head and neck need to be in their stable position, which is up and slightly tucked. So what is the big problem today? Why do I treat 14-year-olds with back pain? People spent years sitting on Zoom like this. People sit too much and they sit all day long. And it's not that I can't get back to here. It's that if I've done this a million times, I've created a new motor program. Well, now my body thinks that this is normal. So until somebody comes along and tells me, no, this is where I need to be, because this actually stacks my rib cage on top of my pelvis and allows me to get to that deep breathing, then I'm not going to do that because I don't know that that's what I'm supposed to do.
Yeah.
Now, when I breathe deeply, and stabilizing is not breathing, I call it like the kindling that starts the fire of breathing. So when I breathe really deeply, and I actually have to allow my stomach to expand, and I have to allow my pelvic floor to drop down, I then have to learn how to create that outward pressure and hold it in a way that then creates stability. But if I haven't learned to breathe, I cannot do that. So first I have to learn how to breathe and stop sucking my stomach in and stop tightening everything and allow everything to lengthen. And when I do breathe diaphragmatically, which means like I usually show people on a balloon, if I push the top of the balloon, if the diaphragm comes down, everything underneath is going to lengthen and expand. And
Right.
when you breathe diaphragmatically, you stimulate the vagus nerve, which is responsible for calming the body down.
So this is what the people I'm around learn, that it activates the vagus nerve and calms you. And even if we're talking about an initial injury, like a physical injury, if you understand this, not only will you injure less, but you'll recover better, and then it won't turn to chronic pain, and then you won't have to deal with. So we're talking about cause and effect. So the breathing is such a key. And that's what I'm very attracted to what you're doing and how you make that important with the breathing, because most physical therapists wouldn't think that's important.
So there are a lot of good ones, and a lot of like a lot of good chiropractors who do, and they're like usually rehab chiropractors that will pay attention to that. I don't know many people that actually explain it the way I explain it, but what I've found is, I'm the kind of person, if you don't tell me why I'm doing something, I might do it very temporarily to get that result of like less pain, but I'm not going to incorporate it long term. My goal is to give people the tools to fix themselves and to maintain that. So if I explain to them why it's important, rather than just saying breathe like this, where I kind of maybe I'm doing it right, maybe I'm not.
Is there, just off the record, is there like a certain number that I go in and a certain number I can go out to just kind of follow a little bit of a pattern that I'm diaphragmatically breathing?
So I feel like everyone's different, because you have people that can be very slow, deep breathers naturally, and you have people that are just super shallow upper chest breathers. So I just try to get them breathing in. Sometimes, depending on the people, they actually have to hold their breath and actually push their stomach out, because they are so used to clenching everything that they have no idea how to lengthen those muscles at all. And then I just tell them exhale slower than you inhaled, as long as the exhale is as long as you can make it.
There's no like 4, 8, 4, and then 8, kind of like what people are learning.
Nothing standard. It just depends on the person, right? And I always tell people, you have chronic back pain, so the doctor will tell you to meditate. But if nobody's taught you how to breathe, you're going to be sitting there going, meditation is stupid. This is so dumb. Why am I doing this? Because most people are not naturally good breathers. There are some people who are naturally good breathers, and they'll be like, oh my God, I can tell you about myself. Before I knew about diaphragmatic breathing, before I knew about anything, I liked breathing. So in other words, when I had my children and I went to those childbirth classes and they taught me breathing, I just made up my own breathing in the delivery room. I literally said to the midwife, just stand there. Don't touch me. Just stand there. Entertain me. Like, talk to me. Tell me about your own kids. Like, just talk to me, but let me do my own breathing. And I literally made up my own breathing. So I always liked breathing, and I never loved yoga, but I always loved Shavasana. And I realized why. Because I'm laying there just breathing. Like, no one's telling me how to breathe, but in my body, I probably was naturally a decent breather. And so
why do you think we're
when
shallow
do you ever
breathers?
lie there and not do anything?
Why do you think we're shallow breathers? Is it because of gravity? Is it because we're talking while we're breathing? Is it because we're not focused or mindful of our breathing? Like, why are most of us shallow breathers?
So I think we live in a society today where we're sitting too much, and the position of sitting tends to be like this. I don't realize that if I've done this 10 million times, I've created a new motor pattern in my body. So I can tell you, I had a 23-year-old kid today, right? Even when he was just sitting and talking to me, he's sitting like this, right? Not because he can't sit like this, but because no one ever told him that like he's created this new pattern. So naturally his body just goes here because that's what it's used to doing. So we live in a society where we sit too much. We live in a society. What's the first thing people do when they're stressed? They hold their breath, they clench their jaw, and they tighten their pelvic floor, their tush, their stomach, they tighten everything.
Lift
All
their
of those
shoulders,
things,
decorate their
including the
ears,
jaw.
get ready for fight and flight.
Yeah, the jaw even is part of this deep stabilizing system. The deep muscles of my hands and the deep muscles of my feet are attached to all of this. And you will never permanently fix a pelvic floor problem if you do not fix the stabilizing system. Like
Wow.
all of this stuff ties into each other. So the first thing people do when they are stressed is they hold their breath, they clench their jaw, and they tighten everything. So what I tell people to do is, wait, now you notice you're doing it. And people will tell me like, yeah, I know that often throughout the day I'm not breathing. Great, you notice it, sit up tall, tuck your chin, relax, just breathe 5 times. Go back to what you're doing. It doesn't make a difference. But if 10 times during the day you stopped yourself, your brain is learning how to start connecting so that you eventually will be one day, you'll be like, oh, wait a minute, I'm diaphragmatically breathing. Like it will start to happen, but it will take, if it took me, 10,000 repetitions of sitting like this for this to become the new normal, it's going to take me 10,000, you know what I mean? For this to become the new normal,
and
right?
2 other things are happening I call it your Pilates belly, when you're elongating your belly a little bit, shoulders back, your chin tuck, and you're just in this relaxed kind of like open position. First of all, you're literally bringing more blood and oxygen, which is just, indirectly. 2, whether I'm breathing naturally or not, it's like I'm creating some attention, and I'm aware, because it's so easy to be unaware. But when I do this, I tell people, do it in the car, do it in the chair, because it puts you into awareness and you're bringing blood and oxygen. So, and and what I think we can agree on and disagree if you need to, is what you just said. We're building a new pathway. The brain you won't feel good doing this. You'll teach yourself that this doesn't feel good. You'll go into this because that's what gravity does, and that's what depression does, and that's what, I'm too tired to do it. But it won't feel good, and you'll be habitually like, oh, I think I need to go into this. This is a little bit more work, but I'm staying aware. I'm staying conscientious.
Right. But eventually it doesn't really become work because they're postural muscles. They actually are meant to kind of hold you up. So it's work in the beginning. And I tell people that in the beginning, no, this is not going to feel comfortable to sit like this for 2 hours. And there's other ways. It doesn't have to be like this. Like you can lean back in the chair and you can lean forward where I'm not rounding my back. I'm actually still lining everything up, but I'm just hinging from my hips, right? Because I teach people to hip hinge. Like I believe that where physical therapy ends, proper training should begin, but you have to have stability first. So I'm training people to be stable at the center, to be stable around all their joints, these muscles that are often not used and people are not working the right way. And then I'm training them in these functional movements of hip hinging and lunging and squatting and how to get to them the right way.
Awareness. You're a meditation teacher. You're teaching them awareness.
Well, that's why when people say to me, do you do yoga or do you meditate? I'm like, no, I breathe. Like, do you know what I mean? Because I get the same benefits out of it. So I don't need to. But if someone likes yoga, great. No problem. I still think you need to pick up heavy weights a little bit, but whatever. We can put that on the side. Only after you're stable. But yeah.
So I want to shift a little bit because the breathing thing is just so important. And I think
no problem. It's like literally my favorite topic. Do you want to hear crazy?
Do you want to hear a crazy breathing story? Because,
I can tell you a crazy but kind of macabre, whatever that word is, like funny but not funny story.
Go ahead.
So I always, breathing has been like my hot topic for years. My second hot topic is barefoot, but we don't have to talk about that right now. They're connected. But anyways, so for years, like I'm very breathing. I talk to my kids about it. And one day, about maybe 6 or 7 years ago, I was meeting my friend to go biking. So I was biking down a giant mountain and she was starting at the bottom. I was meeting her at the bottom so we could come up together. So on my way down, these 4 motorcyclists pass me. And I'm thinking to myself, this is crazy. It's so much better to power yourself. And oh my God, they're driving like maniacs. Fine. I'm still going down the hill. They come back up. Then they passed me going down. They passed me going up. Like that's how quick they were going. And it's a very winding mountainous road. So I meet my friend. We turn around. We start going back up. We come around the corner and two of the guys are laying on the floor. One of them was clearly dead. His head was like on backwards. The other one, his leg was just at a weird angle. But it was awful. Like it was really, really awful. The ambulance came, whatever. So I got home and I'm telling my kids the story. My kids are like, did you go over to him and tell him if he just breathes that he'll be fine? Oh. So that's my crazy breathing story. Yeah, okay. It was bad. It was really, really bad. It was really.
So, wow. So listen, I do also want to talk for a minute now that you mentioned it. And again, this is the kind of things I was hoping was in your bio, but this is.
I'm sorry. Yeah.
No, that's okay. I should have.
I'm not great at writing bios.
You're here, and this is going to go, on my YouTube, and I'm going to title it. I've been singing this song for a while about grounding and being barefoot, and it literally changes your inflammatory state. And this has just been studied, and I'm like, this is like a whole world in itself. And if we could just go barefoot, so talk a little bit about that and the relationship to reducing inflammation. Very important.
Okay. So I can talk a little bit about grounding in relationship to reducing inflammation. I'll be able to talk more about it next week after I interview someone from the Grounding Institute for my podcast. So I have a podcast also.
I'm so excited to.
Yeah. So
and I
can talk a little bit about it. Grounding is 100%. And in order to be grounded, you either have to be barefoot or, like, for example, I'm wearing Earth Runner shoes right now, which have like a metal disc on the bottom. So they're supposed to ground you. But according to what I heard, and I believe it's Clint Oberman is his name, he actually says that you can ground even on concrete. But basically, and I actually have one person who I'm working with who, whatever, she's got a very long history. She has done fantastically better by lowering her inflammatory levels through changing her food, through dealing with hormones. But also I started having her a couple of months ago, go outside every morning, barefoot, in the early morning sunlight, because we can talk about what early morning sunlight does also. All of these things help to decrease inflammation in the body. But as far as the feet and being barefoot, grounding is separate from why I would want to wear barefoot shoes or walk around barefoot. Okay. Like they're kind of two different things, because the muscles that are inside my feet are actually connected up to that intrinsic stabilizing system. You'll see if you push your big toe into the ground, you'll actually feel it in your pelvic floor. So if I really want to make a change long-term, I need to look at what footwear I'm wearing. And I
think that's also why grounding works so much. And I bet you if you asked Clint Oberman,
I have a list
he would say so, but he's coming from,
the grounding perspective.
Doctors, but
yeah.
So again, say it, because this is very, very exciting. So it's not just being barefoot on the beach.
Right.
It's being barefoot in my house.
So again, it really depends on what kind of house you live in. For me, barefoot all the time, it could be barefoot shoes, which are not those ugly Vibrams of, 15, 18 years ago that look like duck shoes. They make probably 150 pairs now. It's called natural footwear or barefoot shoes. There's a bunch of like Instagram and TikTok influencers that will go into like every brand and which one's better. And there's coupon codes and whatever. And it doesn't really matter. Barefoot shoes are shoes that are totally flat, zero drop, that are wide, have what's called a wide toe box. That's not the same thing as having a wide shoe, because a wide toe box means up at the toes, the shoe is wide. A wide shoe means down at like the center of the foot, the shoe is wide. So it's very different. You want a wide toe box, and they are very flexible. So you can kind of roll them up.
What if I don't want to deal with the shoes because they're expensive? So then what do I do?
If you want, listen, there are people that just walk around barefoot all the time and eventually your feet toughen up. I'm not so into that because I've seen a lot of people get things stuck in their feet and, so I'm not so into that. Right. But there are cheap options of barefoot shoes. If you buy regular shoes, there are barefoot shoes that are the same price as the regular shoes.
So yes or no, I can go ground in my house and still get the benefit.
So grounding in your house, probably not. Grounding on a grounding mat. And I see there's someone named Patty who said that she has a grounding mat that she sleeps on, but she didn't notice a difference.
Yeah.
Again,
I want to bring Patty's question up because maybe you can address it. I think, Patty, we can't just be on a grounding mat and wait for God to come. We have to do all the work. I think for a lot of people, they feel like, well, grounding didn't work for me. I think it's a combination. What do you think, Dara?
No, I absolutely
think. And praying and doing the work and breathing. It's not just, but it's one more thing in your toolbox. That's how I would answer.
And
Patty.
also, Patty, so if you can answer this somewhere, what do you mean you didn't notice a difference in what?
In her chronic pain. I think, her chronic pain.
Right. So then,
Yeah.
and I agree that it's a lot of different things. So I can tell you, I have one person I'm working with who 2 years ago had a benign brain tumor removed. And she started trying to come to me for physical therapy about a year ago. We started doing some breathing. She just felt awful all the time. Now, I am not a functional medicine doctor. I call myself like an armchair expert because I do this podcast where, and this is how the God aspect comes in, where I interview health experts. That's how Dr. Tova and I met each other, because I had her last week on my podcast, where I interview health experts in a variety of topics. And then I bring on a biblical or a Torah expert who kind of ties in what we spoke about into where we can kind of find biblical or Torah proof of these things. So I've interviewed so many different people on so many different topics. Like you might see, I have a red light here. We can talk a little bit about what Tova and I talked about before, that maybe we'll talk about red light a little bit. And I do think that there's a lot of things. So if you do have chronic pain and you're not getting enough help just from the breathing and just from maybe what's going on, with what Dr. Tova, if that's who's working with you, then I would suggest trying to work with a functional health practitioner in addition, because they're going to start looking at labs. You need to look at thyroid. You need to look at autoimmune disease. Like there's so many different things that you can look at that can also come into why someone may have chronic pain. So when this woman, there's DNA testing that can be really, really helpful. So when this woman actually did the DNA testing, she worked with a functional medicine doctor. She worked with an acupuncturist. She's working with me. I got her in addition starting to ground and be in the early morning sun and all these things together. Like it took about 3 weeks when finally, when I said, "How are you today?" She came in, she's like, "I'm feeling much better. I have so much more energy." And so I do think that sometimes working with the chronic pain may be enough. Sometimes doing, I explain how I can just explain to how we actually got to each other is that I have a patient who I've worked with originally for a back injury a few years ago. And she came back because she tore her ACL, because she wasn't doing the things that she knew she should be doing. And so we were working on healing that. And all of a sudden she started getting this really deep, terrible kind of pelvic, kind of front of the hip, deep pain. And I kept saying to her, it's not orthopedic. It's not orthopedic. But she still went through the gamut of tests. She herself knows there's emotional things going on. I had talked to her about that during her initial back problem about 5-6 years before. She started working with a psychotherapist on some really deep things. She found out that there had really been a lot of trauma, and she herself was willing to recognize that there was more of a emotional component going on. And she found Tova through the internet. Like she found her, and when she started telling me what she did, I'm like, hook me up. Like I want to learn more. I want to speak to this woman. And
So I'm going to interrupt you. So I just want to say to Patty and anyone listening, it can be very frustrating because even our mutual patient, she's at a 3, not a 1.
Right.
And it's, and Patty, it is a process. And I could call Dr. Schreibner right now, or Dr. Hanscom right now, or Dr. Schechter right now, and they'd say, she's on the right path. Consistency, repetition, keep laying on the mat. Keep going barefoot. Keep doing your journaling. We are changing a pattern, and this doesn't happen overnight. It's like you've just got to stay with this journey and be open and be trusting and be believing. It's not like I want to see results now, and if not, it's the wrong thing. None of the things you're doing are wrong. They're all helping you in a continual. What would you say to that? Because
so I'm going to say that I definitely agree with you, but I will say that there can be this component that may be the last piece of it, because she is addressing the emotional perspective. She is addressing that. And that's something that people are often overlooking, that I can tell you today. Like I saw a friend of mine today, and I'm like, wow, nice to see you upright. Like your sister told me you had chronic back pain, whatever. He said, yeah. He said, now I don't like how he handled it, but it worked for him, whatever. He said, yeah, it turns out I have Crohn's disease. So every 2 weeks I take the shot. The minute I took the shot, my back pain went away. Now, personally, I'm not into that because I have a lot to say about autoimmune disease, but whatever, at least it's giving him his temporary results. So sometimes, again, I don't know what your chronic pain is. but definitely you may need to, look at gut health. I don't know how old you are. You may need to look at hormonal health. Like, it seems very scary and overwhelming because there are so many different things you can look at. But what you do is you do the best you can today. You do the little things you can do. You keep doing those little things. And then we say, okay, so we got, like you said, we got from a 9 to a 3. We're staying consistent at a 3. What else can we look at? Let's add in one more little thing. Maybe it's a movement. And I don't know, what your pain is. And I don't know who you're working with in terms of movement and physical. Like, I do things in very specific ways.
I'm going to give my opinion.
Mm-hmm.
I'm going to give my opinion because I like what you said. I think to do things and keep adding different things depending on the person, but the thoughts trump all. It's a relationship with the grounding. It's a relationship with this person believed in this shot, which took away his inflammation, which took away his back pain. It's a relationship with his Crohn's disease. From what I've learned over 38 years, it's the relationship with what you're doing. And I think things will work better if you don't have expectations, if you trust the process, if you understand that we're changing the brain slowly, repetition. I'm doing a lot more reading about psychology, and in changing brains and changing pathways, it's your thoughts about what you're doing. It's repetition. And even like an emotional sense, like a belief, because it is about the unconscious and, unconscious mind. And remember, 95% of the thoughts are unconscious. So be in touch with your unconscious, and breathing helps you do that. Mm-hmm. So that's where I think, and you have this little bit of way of, because people can go crazy doing too much. That didn't work. That didn't work. Why is it working for someone, not for someone else? I believe it's your relationship with that thing that's going to make it work.
Yes, it definitely could be, but it also could be because people are just different. Genetically, we're different. There are different things. True. And it stinks, I mean, like, it just, life isn't fair. We know life isn't fair,
What do you do when you see that you're not getting someone better with breathing, which I think is ultimately...
Well, it's never just breathing. Breathing fans the flame. It's never just breathing. There's a lot of movement. There's a lot of learning how to use your hips the right way. There's a lot of learning how to use your scapular system the right way. Like, I tie everything in because I can sit up as much as I want, but if my shoulders are up by my ears, even if I'm sitting up, ultimately I've got to connect the scapular stabilizing system in with it. So I actually connect the entire thing. And then, of course, I'm also focused on, like, what are they actually coming in for, right? Like, I can't, you know what I mean? I have to tie it all in together, and that's what I start to do. Right. I do focus, and if it was a broken ankle, we're certainly working on the ankle.
Right. So I know Patty will relate to this next topic because I think I've seen her Facebook pages, and I really do think I appreciate when people have God in their life and some divine source of inspiration for more than their doctor or their journaling or their next shot, that there's somehow something bigger. Because look, all of our egos are getting crushed. I mean, we're not getting better. The doctor said I was supposed to, like, it becomes this, this conflict. And if we can sometime go to bed each night and kind of give it up to God, what I say, or somehow trust another day that we're not a victim of our body, and that our body's giving us a message, it's protecting us, it's not punishing us. Our body's not against us. And that I relate that to God. So I would love to hear how you think what God has to do with healing.
Well,
from your point of view, I think
ultimately, I do believe, and this is the sort of tagline of my podcast, is God decides when you go, but you decide how you get there. We can do everything right, and ultimately, the end of the day, it's still, I believe it's still up to God. And I think that when, on the one hand, it's like easy to say, like, I don't stress about things because if I don't have control of something, I don't get stressed about it. Because if I can't control it anyway, why am I going to waste my time thinking about something I can't change? Now, that's part of my DNA, though, I can tell you, because I did DNA testing and I know what my personality DNA is like. And that's part of my DNA. And I'm very lucky that's part of who I am. But ultimately, I do believe that if we repeat things, just like you said, if we repeat things and we take them in and we keep trying to change that, we can make a change. So if we understand and we believe that there's a God, it's actually almost easier to say, you know what? I can only do the best I can do. And I can do the best I can do. But at the end of the day, it's up to God. Like if something doesn't come my way, it's God's will, but at least I made the best effort that I could possibly make. And, if we don't make any effort, you can't blame God if it doesn't, you know what I mean? But you have to be willing to accept that you could do everything you can and maybe it's still not going to turn out. You may not get the answer you want. And for me, that makes my life so much easier and so much less stress-free, because if I know I've done everything I can, then okay, if I don't end up where I want.
It's so compassionate. It's so accepting. It's so because ultimately everyone is doing the best they can. Patty, you've been at this a long time and you're doing the best you can. And the fact that you're not where you want to be doesn't mean that you need to do one more thing. You just need to accept and honor and be compassionate. And this is where, the science of self-compassion comes in and how important. And, for me, God and compassion and gratitude and forgiveness are kind of all one. And all this is chemical. I mean, God is spiritual, but believing in God can be a very chemical, positive thing for your body, because you're accepting, you're loving, and loving is awareness, and awareness is chemical. So having a God figure, a God person, a God concept, a God divine, it could be nature. Nature is the greatest doctor. Nature is the greatest doctor of all. And it's chemical when we're in nature, whether we're grounding, whether we're breathing, whether we're out there with sunshine. So talk more about how people can use God. Let's say they don't really believe in a God, but they can still be compassionate and loving to themselves.
100%. That's why I ask every person who comes on my podcast, my big one across the board question is, what does spirituality mean to you? Because I believe that everybody has a spiritual essence in them. And being religious and being spiritual are two very different things, and they mean different things to different people. And I think it's having some of that spirituality and thinking about what makes me feel spiritual, being out in nature, being out in the sunshine, looking at the ocean, all of these things can be very calming for the body. Maybe not for everyone, maybe for someone else, it's something else. And it doesn't really matter. People don't have to believe in the same God, and they're, I'm Jewish and you're Jewish, but other people aren't Jewish, and that's okay. But it's when you have something and you believe that the world is kind of bigger than you and you can't control it all. I think that with women, it's women in particular, I'm always telling women, you have to be selfish with your health. For whatever reason, I'm someone who was always really good at being I kind of, even when my kids were very little, I knew what I needed. If you just I don't mind waking up at 5 a.m, but I need to go to the gym I need to exercise for an hour. As long as I had that hour, I could be fine the rest of the day. But if I didn't get my time, sometime, I couldn't be good for anyone else later. So I just kind of instinctively got that. But more of my women patients and more women in general, they want to do everything for everyone. And they're so stressed over, oh my God, and what if I make the wrong choice? I had to make a very difficult decision when my daughter was in first grade and she really needed to repeat first grade. And it was such a big struggle. Should she repeat first grade in the same school she's in? Should we send her to a different school? Should we just let her go to second grade and then see what happens because we're moving back to Israel after the year? And ultimately, I decided a long time ago, you know what? She could yell at me when she gets older and say, you ruined my life because back and forth, I should have done this or that. What I will tell my child is I did the best. I actually did what I thought would be best for you. If it didn't turn out that I'm really, really sorry. But I also teach my children that everything in life, there's no such thing as failures. Everything you go through happens for a reason, and that makes you who you are today. And I hope that you like who you are today. So we wouldn't be the people we were if we didn't go through the experiences we went through. And that's why I also think, we try to keep our children from repeating our own mistakes. But ultimately, why do they do some of those same mistakes anyways? Because they have to experience for themselves. A baby learns by failing, right? They try to stand, they fall down. What do they do again? They try to stand, they fall down. And all of that failure is creating circuits in their brain, and it's teaching them, well, what is the right way to figure out how to do it? And then we mess it up again as we get older and, whatever. But But like everything is a learning experience. And if you can like learn to repeat that to yourself and teach yourself that it's like okay and it doesn't matter what's going on and you're only doing the best you can and be compassionate with yourself, which sounds so cliche because everybody says, be compassionate, it does. But it really, there is truth to that. And even just starting with like little things and, it makes things so much easier because people are tense because they're trying to control everything and we can't control everything.
I'm going to ask you this question because I asked a big psychologist this question, a big doctor of psychology, an ISTDP psychologist, which is this type of therapy that Rose does. And I asked her, and I want to see what your answer is. Listen, most people, they don't know how to be compassionate. Like, how do we learn compassion? We didn't see it growing up, or we saw it kind of dysfunctionally. Like, how do I learn to be compassionate to myself? And I know what she said, but what do you think?
That's actually really interesting. So that's such a good question. Like it's something I would have never really thought about, but I guess it starts by doing the little things to take care of yourself first. Because if you don't do things to take care of yourself, you're not being compassionate to yourself. So for example, people are paying me privately. Like I don't work with the health funds here in Israel. So somebody's coming to me and they're already spending that money on themselves. If they're not going to go home and do the exercises, they're wasting their money and my time, right? Like meaning if you can't learn to do the things that you know are really good for you, and I'll give them suggestions. I get that it may not always be easy to do it in your house. Because let me tell you something. I had kettlebells in my house. And I could always do the laundry. It's like after the laundry, after the dishes, right? But if I went out somewhere else, like I'll tell people, even go to your gym. Just, I don't care. Do only my extra, But if being compassionate starts with taking care of you. And most women will always put themselves last. It's always, no, but my kid needs me. And by the way, this woman who is doing so much better now, that was one of the things that was happening in the beginning. She kept like canceling because this kid needed her and that kid needed her. And this one was going to have a baby and that one was moving. And I was like, listen, I was like, you should not be packing moving boxes. Like you need to, or if you're going to pack moving boxes, you need 30 minutes to yourself first. You need to do your things first. And listen, I don't care. You gave me enough notice to cancel therapy where it's your right, cancel the therapy. I don't mind. You're not canceling at the last minute, but you need this for you. And if you don't first learn to put yourself first, sometimes there's no way you can be good for anyone else. It's that same.
Why is that hard for people? Why is that hard for people to not?
I think it's more women than men. I think men have a much easier time. And if you're an Orthodox Jewish man, you have a lot of really good excuses. It's mincha, it's mariv, it's we have to.
No, but why is it that people get more attention and approval and recognition from doing for others than themselves? There's something.
Oh, it's a great question. You're right. That might have something to do with it.
They're not getting the pleasure. They're not getting that pleasure from taking care of themselves. And
I'll tell you why.
You and I've learned that, and you've learned that.
I'll tell you why, though. Because when you give to other people, it does something for you. So there is truth in that when you give to other people, it does make you feel good as well. And we do grow up learning, like you do what you can and you give. And like, there are so many people in my community who I'm just honest. Like unfortunately I have 6 friends that lost parents in the past 4 weeks, like 6. Now people can say it's the age, maybe. Okay. But when I've gone to these, Shiva houses, these like funeral, like the 7 days, mourning period afterwards, usually it's customary, like people make meals and whatever. And I'm very honest. Like I don't make meals for other people. I can barely get dinner on the table. My 19-year-old will say to me, what's for dinner? And I'll be like, you were home all day. I was working, like whatever you're making, or I'm sorry, there's leftovers, if I can barely cook for myself and my family, like I can't, even though most people want to do it because they know it's the right thing to do. I'm like, I will do anything. I will like go shopping for, like, I will do what I can do, but I'm not going to force myself to do something that will take away. I mean, I guess this is selfish.
That's a constant conflict. I bet you it's a conflict in a lot of people's brain, the guilt, which is
right. I've learned as I've aged, I've gotten better at saying no. Because when I was younger, it was definitely harder.
So, Dr. Gabriel Mate, which is this big internist doctor that his book is called When the Body Says No. It's because you're always saying yes.
Right.
So, it's a book about stress illness. He calls it stress disease. So, and Patty, yes, it's true about people pleasing. And part of it is this. So I'm looking at balance. We're not saying please yourself 100% and don't please them. We're looking at balance. okay, one night you're going to make dinner, one night the kids. So it's really about balance. And this is another reason why people might not be getting better when they need to, or having, not being able to be in recovery, or not getting, because this sense of balance, this extreme, and a disease is an extreme reaction to the body. Chronic pain is an extreme. It becomes this extreme when your body finally deals with the chronic pain, and the pain is become physical from an emotional reason. It's extreme. The body's completely imbalanced. So we're back to balance. We're back to breathing. We're back to physical. We're back to the sense of balance, the sense of like I always say, like the pendulum's going like this, and the pendulum needs to be moving, and it can go like this, but it has to be able to come back to the middle. It's a sense of balance. And we know what balance is. We know what giving to ourselves is. People know what compassion is. So this woman said, the psychologist,
right,
said, how do you treat a puppy? I know you have new puppies. And how do you treat a little baby? With unbelievable gentleness and compassion. And that was how she said, that's the feeling you need to give yourself. Like the time you would take, the patience you would take, the tenderness you would take, to do that for yourself.
I totally agree with that. And what I do want to add is that even if you are going to say yes to the other things, you do you first. So if you're someone who's in chronic pain, nothing comes before you doing your breathing and your exercises and whatever things, if it's making your food a certain way so that you're eating healthy and looking after your gut, like you have to do you. So do it in the morning and then do the things for other people, but you don't do for other people unless you've taken care of yourself first.
Yeah.
And it could be, I'm going to give myself 10 minutes or 15 minutes. Okay. But like you do need to do something for you. And it's true that very often what happens is people who've been caregiving, right, for a really long time, when do they get sick and break down? When the other person gets better, because all of a sudden their body realizes that okay, I can you know what I mean? And so that's why it's important. Even if you are caregiving for someone else, you have to find a way to make sure you're taking care of yourself also. Even if 20 hours a day you're with that person, those other few out, you have to make sure that you are taking care of yourself as well.
It is so important. It is so, so, so very important, Dara, that you're talking about this. Whether it's the example of how we put the air mask on in the airplane,
right?
Put on someone else. It's so important, and it is such a key factor. I promote this movie, and Susie is joining us from Britain. She's working with one of the doctors in this movie, Dr. David Hanscom, and I promote this movie called Love Heals, and I've got to turn you on to it. It's one of the most amazing films, along with All the Rage from Dr. Don Sarno, and this Pain Brain movie about the neuroplasticity. The Love Heals. I mean, we're back to, and I'll even say to Susie and Patty, do you 100% unconditionally love yourself? You accept and love yourself? Because this is a chemical reaction, and your brain feels when you're judging or when you're critical. And yes, we've all been criticized by our parents. We've all been traumatized by that generation. And and I'm really upset myself, because sometimes I would say to my daughter, I'm so disappointed in you. And she took that as complete criticism. And I thought I was being really gentle with her. And she's, now 24, remembering that I would say, I'm disappointed in you. And I'm thinking, shit, why did I say that?
Because you were doing the best you could do at the time. You don't need to, you know what I mean? I just don't look back. I'm like, okay, I've said some bad things to my kids too. And where my daughter is like, Ema, really? And I'm like, you're right. I'm sorry. Whatever. You can't change it. Why dwell on something you can't change? Okay, maybe I did a bad thing, but guess what? Get over it. No. I can't change it.
Right. Yeah. And really, it's more like it's done. We did the best you could. I mean, it's great that you could heal with your children. I mean, I feel like I gave my daughters some difficult, they both have some anxiety, and I'm like, I did it. I gave anxiety, but we're all healing together. We're all reading, all these, we're all self-reflecting together. So this is the opportunity for people who understand that I did the best I can, but
guess what? And here's what might make you feel better, or maybe it won't. There's a gene for anxiety. I don't have that gene, right? So meaning the whole point of DNA testing, which I love, I interviewed Kashif Khan, who is literally one of my favorite people that I've interviewed from the DNA company. And the thing is that certain personality things I really knew about myself, but it was kind of cool to see where you have better copies of genes, because then they tell you, well, if you have the anxiety gene, this is what you should do, in addition to what you're doing. There are supplements.
There's an anxiety gene, really?
Yeah, there's a gene for people that have it.
Everybody has it.
I will tell you.
Everybody has it.
I know. No, you can have an anxiety gene, and you can have a phenomenal copy of that gene where you're going to be somebody who doesn't have anxiety. Or you can have a suboptimal or poor copy of that gene where you are far more likely to be anxious. Now, again, nature versus nurture. Do you know what I'm saying? Nature versus nurture. You can, you know what I mean? I think that if you've already got that gene and your sister or brother doesn't have that gene and you grew up in an abusive household, one of you may be very resilient, because even a resilient person can become not resilient, right?
Yeah.
Our goal is, if we know, so that's kind of what's interesting about like DNA testing, is that I was almost like, well, wow, we should DNA test every child when they come out, because if we know that someone is more prone to anxiety, then we're going to see, what do we do not to turn that gene on, right? Just because somebody has the BRCA gene, it doesn't mean they develop breast cancer, right? So what they did was looked at, what did all the people with the BRCA gene who didn't develop breast cancer, what did they do? Well, those things are probably good for everyone to be doing. And yes, Susie, look at the DNA company, Kashif Khan, on Instagram, Facebook, wherever. He is literally one of my favorite people.
So phenomenal. But I want to address what Susie said. So we are not designed to love ourselves. We are designed to survive, which is true, because biologically we're ready to fight in flight or freeze. And, we're in that. So we are kind of pushing against a certain nature. This is true. And we do have to learn compassion and gratitude and forgiveness. We have to learn it, and we have to practice it. And then we keep getting bombarded with, forget that, but I'm going to say, but it's true, Susie. And what do you think about that, Dara? We are designed to survive. We're not designed to love ourselves. Yeah. It's an interesting statement.
We're definitely designed to survive, because there's always been survival of the fittest. I don't know. I think that, I say thank God all the time. Like, I feel like I won the lottery of parents, right? Like if you listen, my very first episode of my podcast was I interviewed my parents to find out how I became who I am, right? Like how I grew up. And I know, listen, I may not myself have a lot of money or a lot of other things, but I've seen very well in my practice and from working with people that money doesn't buy happiness, right? But ultimately, where it counts, thank God, I have an amazing family. And not everybody had that. So for example, I have a friend who it's hard to be around her because she complains all the time. And I'm a problem solver. So if you're going to complain to me, I can't sit there and look, oh, that must be awful. That must be so hard. It's not in my nature. My nature is to try to solve your problem. So if I'm going to try to solve your problem and you're going to knock down every suggestion without trying,
I'm going to interrupt you. So but I know that you got divorced from your husband and your very good friend. So how did that fit into that?
It took me a long time, because I really struggled with the fact that my ex-husband is a very good person and I am a very good person. We just really weren't right for each other. So part of me felt like he doesn't beat me. He's a good provider. Like, religiously, Jewishly, Torah-wise, is it okay to get divorced from somebody when like other people are staying in marriages that are really bad? And I actually went and I spoke to a rabbi and I spoke to a rebbitzin, and they ultimately explained to me that yes, it was okay. Yeah. At the end of the day, both of us wanted to be divorced because we really, like, there was a reason why. Like, the stupidest comment I ever got from somebody was, because we were married for almost 20 years, are you sorry that it took you so long to get divorced? And I was like, are you kidding? We have 4 amazing children. Like, there was a reason why we were together. There's a reason why we were together as long as we could. People who meet my kids, like, I think my kids are healthier than kids whose parents are married often, because they see that, their father and I get along. And again, I think I'm not going to tell you that every single thing was amazing and there weren't little arguments and little things here and there, but ultimately, like, he's a good person, right? And I know I'm a good person. So we were like 2 good people. We just were not right for each other.
You see your divorce as an evolution of your life, and it happened this way, and you're not like, so it's almost like, so this is very important, because your life is not a smooth ride, but it is a smooth ride,
right?
Because of your attitude and your relationship and your acceptance of
I
reality.
think so, but then I also say, like, there but for the great grace of God go I. So in other words, I was dropped into this incredible family and this supportive family, whereas this friend that I was talking about, she like didn't even know her father. Then her mother became religious, got remarried, came, that father died, got remarried again. This the third one was kind of like a, you know what I mean? Like it's just a very different, it's very, very different. And I think that, I recognize that different people, not everyone can necessarily comes from the same place. People went through a lot of really terrible things that I didn't have to go through. And so all we can try to do is help them change that. So back to the very beginning where you said to me, like, how did I get into Sarno or know about Sarno? So I've been told about Sarno for years, but I told you this when you came on my podcast. You were like, how can you tell when somebody's problems are emotional? I guess I'm an empath. Like I can tell when somebody I can feel it, I can sense it, I can tell when there's something more. Now, 19 times out of 20, when people, learn to breathe and stabilize, even if they're not directly addressing whatever that emotional trauma was, they're usually getting better because of what the breathing does for you. So usually they're healing and they're getting better. But if I teach you to breathe and stabilize and move well and move through your hips well and you're still having pain, well, that's when you've got to deal with it psychologically, emotionally as well. And so I know I don't have those tools. I think I'm a good, maybe I may not be a great listener because I try to problem solve, but I think that but I'm not trained I am a therapist, a physical therapist, but I'm not a psychotherapist. And I think at a certain point, like they have to know what to do if they're going to really face that trauma head on, because, I think you said it, like, if we get rid of the pain because you're now left, you've got to know how to deal with whatever that trauma is. And not everybody, went through like a trauma free, like everybody's traumas are different, and some people went through some really bad, really traumatic childhoods. But if you also give yourself a break and understanding that you may be genetically wired to be more anxious anyways, well, then it's looking at, well, what do I do to try to get a handle on that? And, or at least being compassionate with yourself to
Or
understand.
just know yourself. Like I don't need to go to the DNA. I know I lean towards A or B because I know myself, and that's also part of the healing, is to know yourself, is to know how you are wired, to know how you relate. What is your pattern of relationships with the people close to you? What do you do with your anger? What do you do with your fear? What do you do? And this is also, and chronic pain can teach you about yourself if you see it as, okay, so what can I learn? I'm not a victim of this pain. How can I learn about myself? How can it propel me to be more compassionate, more loving, more understanding? And this is where, also I love Judaism because it talks about, finding the gift. It's big on that. We're not a korban, which is a victim. We're not a victim. We are not at all. There's always a gift. And when you're ready to look at and, turn things around, and this is also part of the law of attraction, which I've been studying, the neurology of the law of attraction, the psychologic, that it's physical when we can visualize and see our future, see me out of pain, see me with less pain, see me evolving, see me feeling better on my sleeping mat, Patty, or see me accepting that I'm not walking so well, sort of like being on your journey and seeing it as an ongoing evolving, and that it's not black or white. So I think it's beautiful. And some people, they want it. I think the DNA testing is phenomenal. I mean, it wasn't so expensive. I think everyone should have it. Should be given in the healthcare system. Is it an
I have a
expensive?
coupon, but it's a little pricey.
Is it an expensive test?
I mean, with the coupon, it's $425.
Yeah,
But it gives you
a blood
hours.
test. It's a blood test, right?
No, it's a spit test. It's a spit test.
A spit test?
And it's giving you, it's spit. It's DNA. It's not blood.
And how would somebody, if they knew that they had an anxious gene, how would that help them heal chronic pain?
So they give you a whole list of lifestyle factors, supplements, different things that you can do to combat it.
Wow.
Right? But it's also then, how do those genes play together with other genes, and what do your hormones look like, and what do your detox pathways look like? Like some people have very poor detox pathways. What does your vitamin D carrying capacity look like? Like I couldn't understand why, before COVID, I don't wear sunscreen, and we're not going to get into why I believe that we shouldn't, but I don't wear sunscreen, and I bike outside in the sun all the time. And yet, when I did at the very beginning of COVID a vitamin D test, my vitamin D was low, and it made no sense to me. I'm making natural vitamin D, so I started supplementing and taking vitamin D, and I got my levels up to over 50, and that was great. And then kind of COVID ended, and I stopped really taking the vitamin D, and I'm back out to biking in the sun and whatever. And I just had a blood test a couple weeks ago, and it's back down to, like, let's say 35, which is still okay, but not great. Like, the alternative people and the functional people want it up 50, 60, 70, even 80. And I know why. It's because my DNA, I do not convert vitamin D from the sun into usable vitamin D in my body. I do not bind vitamin D well to the receptors where it should bind, but I carry it really well. So if I take like a couple thousand, IU of vitamin D twice a day, my body can carry it really well, and some of it'll bind. And if I do it twice a day and I break it up, I'll get more vitamin D bound and I'll get my levels up, right?
So in that way, it can really help people understand maybe why they physically or physiologically react the way they do.
Yeah. And it tells them a lot about like how they detox things like estrogen. As people hit menopause, like things change dramatically, and you need to look at your hormone levels and maybe replacing some of them with bioidentical hormones, or maybe not, or at least understanding what happens to estrogen in your body. And right, because people that get breast cancer don't detox from estrogen well. So if you know that in the beginning, you're going to get clues on what to do and how to do it. Yeah. And while I absolutely think this emotional piece is big, like if we're attacking that emotional piece, I think that if someone's not 100% seeing the results they want, there are other things they can then slowly add in a piece at a time and look at a piece at a time, So
I really love all the things that we touched. Really, I really love dialoguing with you.
Me too. I could go on for 10 hours, but I
want to leave the show. I want to leave the broadcast in a few minutes, and I want to leave the show with some really, like, for now, what can people do regarding breathing? If they just want to walk away with a tool or insight, like to put things in people's toolbox, in their what can they do? How can they immediately become aware of how the breathing can help them?
Okay, so again, there are people sometimes that will tell me, like, I'm doing your breathing, and then I'll actually watch the way they breathe, and I'm like, well, you're breathing, but that's not the way I want you breathing. It's not always easy to tell what you're doing. First of all, the best way to get diaphragmatic breathing initially is to lie down and put your feet up on something, because if your feet are up, your rib cage will be across, or your diaphragm will be much more across from your pelvic floor, and they need to oppose each other in order to get that deep breathing. So
your feet straight up, your feet straight up?
No, a 90-degree angle, 90 degrees on a chair. Like just put your feet up with your knees bent on a chair. Sometimes the knees need to be even a little bit closer to your chest, because you want to get the diaphragm and the pelvic floor across from each other. You want to make sure that your chin is kind of tucked. So if you lie down,
like a turtle,
you might have to roll up a towel and stick it under your head to make your chin tuck. And then the easiest way to start getting a handle on it is put one hand on your chest, put one hand on the lowest part of your abdomen. You want your tongue on the roof of your mouth. The tongue ties into the system as well, and you want to breathe in and out of your nose. Okay, there's a million reasons why nose breathing's better. It stimulates diaphragmatic. There's a million reasons, but you want to breathe in and out of your nose. That's what you want to be doing. And you want to start assessing, am I breathing where I'm getting a lot of movement in there? Or am I breathing where more of the movement is going downward? If you get very relaxed within a couple minutes of breathing, you are probably starting to breathe. You are starting to breathe diaphragmatically. But if it will not necessarily be easy, because when people are upper chest breathers all the time, they're actually are going to feel like you're not getting enough oxygen. But through forcing it, through doing it every day, maybe a couple times a day, you will start to feel a difference. And you might have to kind of breathe in really deeply and then hold your breath, and then see if you can actually push your stomach outward to see if you can lengthen those muscles, because some people really can't, right? So you may need to do that a little bit as well.
Is the goal that we're breathing diaphragmically all the time?
I'm sorry?
Is the goal that we're breathing diaphragmically?
Eventually. It'll take a while, because then you do want to be putting it into other positions. But generally, the two easiest ways are either lying down with your feet up. If that doesn't work, that works for 9 out of 10 people. If it doesn't, sometimes actually being on your stomach where you're getting feedback from the floor, that will become a lot easier. But
No,
but I can still tell you there are other people where I had to make something else up but for 9 out of 10 people that will work well.
What do
But
you
if
think
you're
about
that 10th person, I'm
what do
sorry.
you think about the Wim Hof breathing?
I have to be honest. I know who Wim Hof is, cold immersion. I personally detest cold immersion. I don't like it, but I'm also not a person that has a lot of anxiety, and I like sauna much better, right? So meaning I love heat and I love sunlight, and I'm very attracted to sunlight. And I think the people who love that, that's kind of what I noticed, because I've got a friend who's a massage therapist, and she actually does acupuncture on the pelvic floor. She does a lot of trauma work herself, and she loves it. She's always trying to get me to go into cold, but she's a person who has a lot of anxiety. So I think that absolutely there are benefits to everything, and I think it's figuring out. And I don't know enough about Wim Hof breathing because it's not necessarily always diaphragmatic. It's kind of, they say deep, but let me tell you something. I watch people breathe deep where they're going, that's going to cause over breathing. Do you know what I mean? So like sometimes you'll do what I'm saying and it still doesn't come out right, but it's not a competition. So then you need to go to somebody who can help you and who can assess that breathing for you. Sometimes people need kinesthetic, feedback. Sometimes people actually need to release their stomach muscles because they're so used to clenching everything so tight that those muscles just don't even know how to lengthen. And every person is different, right?
Wow.
Again, what works for most doesn't mean it'll work for every single person. Like,
So
it's
important.
figuring out for each person what works for you.
It's so important. And I wish, I wish doctors would be more like, well, this is your individual journey and you need to try this. Like, this is wonderful, wonderful advice from this studio about self-healing and how people have to find their way, find what works for them. There are universal laws of nature. We do need to breathe deeper. We do need to breathe calmer. We do need to tap into our sympathetic nervous system. We do need to create our own opioids and our own cannabis and our own, anti-inflammatories in order to help. And that comes from the exhale. And so we've really uncovered some amazing things here. And we haven't even touched on the fact that like the breath is God, which to me is like like the word for soul in Hebrew is the same word for breath and
the same root word.
Yeah. And so
so when you take in your first breath, that's when the soul enters your body. And when you take your last breath, that's when the soul is.
Yeah.
There's a huge connection. Breathing is huge in Judaism. And I've done a couple of episodes on breathing where that was brought in by different people, like sort of a bunch of the different biblical.
Wonderful. Maybe we'll meet again after the holidays and talk about grounding. We'll show this little.
With pleasure. I'll have learned a lot more about it myself.
It's amazing about grounding. I'd love to, after you have your podcast, I'd love to talk about that. So Patty has a question. I do practice breathing and it truly resets. Wow. Amazing.
That's great.
Amazing.
So now, Patty, if you can find someone or an online program, or if you tell me where you are, I can help you find someone, to teach you what to do with the breathing to turn it into stabilizing. Again, I don't know if your pain is chronic back pain or what your chronic pain is, but if it's like back pain or neck pain or pelvic floor problems or a lot of stomach issues or hernias or anything connected with all of that, if you learn what to take the breathing to the next step and how to use it to stabilize your body, that sort of gets it to hold on long term. I always call it like, the glue that kind of holds everything together, I guess. Yeah. And so sometimes you need someone to help you do that. There are a lot of YouTube videos and a lot of things, but a lot of times people really do need someone to help them and just guide them. And once they get it, you don't forget it.
Yeah. No, it's good to know. Thanks, Patty, for sharing that.
Yeah. And I'm glad to hear that because that should help.
Yeah. Blessings to all of you out there. And you can just text me, email me. Dara is on Facebook. You can find her on Facebook, Dara Stecker.
I am, but my big thing is Instagram. My Instagram is
Instagram. Find her on Instagram, but you can also find her through me.
Yeah.
She's available here to help you. And you guys always know I'm available here to help you. So have a wonderful evening. Thanks for joining us. And God bless you all. Have a wonderful week. Dara, I love you. I hope
to see you. This was so much fun.
Meet you face to face real soon.
Absolutely.
Until then, thanks for joining us. Thank you so much.
It was my pleasure. It was really a lot of fun.
All the best.
Thank you.
Okay, so we're going off. 1 second.